right, today I'm really excited to introduce our 15th CCC speaker, Dr. Vittoria Colizza. Dr. Colizza is a research director at INSERM, which is the French National Institute for Health and Medical Research, and she leads the EPICS lab there. She's an expert on theoretical physics and infectious disease modeling and uses complex system science to understand emerging infectious diseases. For her work, she received the Erdos Renyi Prize from the Network Science Society for contributions to fundamental and data-driven network-based modeling of epidemic processes. And that's a very prestigious prize from a very large complex systems society for young scientists. She has carried, from that work, she carried out, the work leading to that prize has really been groundbreaking in the field with attempts to characterize how network topology and temporal factors impact infectious disease spread, trying to characterize with large-scale data sets contacts, behaviors, and mobility of hosts can impact infectious diseases. Specifically, one of her key projects has been looking at global airline travel networks and their relationship with infectious disease spread. And she was instrumental in contributing to the GLEAM global simulator that we as a consortium looked at a couple months ago now. She also has been key for designing surveillance systems, both in cattle and in humans. And specifically, she leads the digital surveillance of I'm going to pronounce this wrong, GRIPnet, the French influenza surveillance network. And then, today she's here to chat about COVID-19. Some of the work she's done there, really just, a huge number of reports her team has put out on COVID-19 over the past few months. Her team conducted the first risk assessment of importations into Europe in early January. They conducted analysis of the vulnerability of African countries and cities. And then, like I said, just a bunch of other reports. And I think today she'll be discussing the current situation in Europe as they face a resurgence of COVID-19. So we're really happy to have her here today, and I'll let her take it away.
Thank you very much, Spencer. Thanks, everybody. Thanks, Professor Meyer, for the invitation. I was really looking forward to this. I've been following your work over the last few months, and I thought it was also very much inspiring for what we've been doing. You should see my slides at the moment, so I hope all of that is okay, and otherwise just please give me a sign. So I wanted to, let's say, to talk about the situation that we have now in Europe, especially because I'm sure that we can learn from what you've been living in the last few months in the US. And to do that, I just, I'd like to thank, of course, there is a bunch of people who've been behind a lot of this work, a bunch of funders, and this work was done to inform some of the, let's say, national authorities who are engaged in the fight against the pandemic, and on mostly the Public Health Agency in France, but also the Minister, of course, of Health, and Minister of Economy, and Minister of Research, and then some other collaboration on the international level. So this, just to give you a glance, this is the current situation in Europe since the very start. Here you have the number of cases detected by each country, well, notified by each country to be more precise, and they are stacked one over the other. So I highlighted just a couple of them, a few of them: UK, Spain, Italy, and France, that had the largest, some of the largest outbreaks registered in the continent. The phase in which we went under lockdown for France is the one that is identified on top of the figure. Very much it was almost the same for a majority of countries. Italy was the first going into lockdown on March 11. We went into March 17, so about 1 week after. And we exited lockdown on 11th of May, so after 2 months. United Kingdom, for example, started a bit later, but the majority, as you can see, of course, from the curve, was about that time frame, let's say plus or minus 1 week. And it was the one lockdown here was enforced nationally. in all the different countries, and was typically a very stringent lockdown in which we didn't have the opportunity to go out except for food and medicines and medical care in general. And it lasted along this way for 2 full months. And everything was closed. Only essential services were allowed to be open.
Was there a clear criteria for lifting the lockdown when they did lift the lockdown?
No, and indeed this was part of some of the studies that we made. So, well, 2 months, let's say, is a good timing in order to make some work in the, let's say, during the period, modeling work in the period, especially if you consider the usual delay, of course, in cases. We've been using admissions to hospital to calibrate the model. But specifically, even with the delay of arrival of this data, we were working about more than 3 weeks after than the actual events. And so that means that by, we prepared all the modeling work, and we basically wrapped up our first report on the impact of lockdown in the 4th week of lockdown to make it available to authorities at that period. And it was really in the middle of lockdown that lasted 8 weeks. And for that reason also, we were not able to use, for example, hospitalization data during the lockdown to estimate that impact. And our estimates were purely based on assumptions of how the contact metrics was going to be altered by the measures implemented. So no school, no leisure activities, non-essential services, very few people going to places of work, and we used mobility data to inform that aspect. And so what you see, for example, in the first plot is that we used the black data point that is still the rise, the exponential rise, to estimate, to calibrate our model. And then we assumed a certain reduction of these contacts is based on empirical data on contacts during normal conditions, and then taking out all these contacts on those activities like school, less people at workplaces, transport, leisure activities, and others that were not allowed anymore or were partially closed. And by doing that, we proposed some estimate of the expected impact of the lockdown. And there I'm showing what we proposed at the beginning, which was the red line, and then what ended up being the actual fit on the lockdown phase. So it wasn't too bad. And I think that the most important decision for exiting the lockdown that was announced on April 12th, so it was the day after this, and it was announced for 1 month after. May 11th, it was the first day to go, that was supposed to exit lockdown, given some conditions. And one of those conditions was, of course, to have a test, trace, isolation system in force, fully in force. Up to that point, all European countries, probably except Germany and Iceland, were behaved extremely poorly into testing, and then especially during the health crisis of the first wave. So this meant really a complete reconstruction and from zero of the framework for test and trace. And also there was a strong communication to convince authorities, and we used also models to show that. Because there were still, the narrative at that point was still, we're testing only symptomatic cases. And so that was, that of course was very important. And in that moment, we also tried to provide some possible exit strategies. Of course, we made some assumption on what would happen without test and trace. And that was where we insisted that it was an important key component for phasing out lockdown. And these 4 exits that you see in the bottom, there we plot the ICU beds required to keep the epidemic manageable. And those are different combinations of the efficiency of your test, trace, and isolation system in terms of what percentage of cases of infections you're able to track. And on the other hand, what type of social distancing interventions you need to put in place for the population. That is not only physical distancing, but is also what kind, for example, having some commerces still closed, restaurants and bars are still closed. And so depending on how the combination of that, and even if you make these things vary in time, we obtained a few different curves over there. And I'll just, and this was the situation, let's say, with which we exited lockdown. Once we exited lockdown, the situation was very favorable for all countries in Europe, France included, and we saw a continued decrease of cases even when phasing out. Another advantage was that few things were progressively being reopened, but at the same time there was much more awareness of the population, and who started using in a more rigorous and systematic way preventive measures. And also the use of masks started to be adopted from basically 0 during the first wave up to 50% in the month of July. We never went beyond that. What you see in the ECDC map here is the case notification over a 2 weeks period, which is the one highlighted on the timeline, where of course you see, and the incidents, resulting incidents, and you see that Spain has the major increase, followed by France, Belgium, the same, and now also Italy, that was the largest, or the first country to be hit in Europe, is now seeing an increase of cases, even if at a more moderate speed. So and let me just highlight this exit 3, because I go back to this scenario at the very end. So to show you what was the situation in reality in May and June when we exited. This new system for test, trace, isolation that also created a centralized database to collect data in the same way, systematically, all over the places. Because of course, as every country, us too, we had a lot of problems in data collection, and we still do have those. This system was not at the end really performing as expected. The delays were really large, especially at the beginning when we exited lockdown. And this was delays from onset of symptoms to moment of testing. And this was also due to the fact that a lot of people during lockdown who had, for example, symptoms didn't go to the doctor, because recommendations were not to saturate the healthcare system, not even GPs. And so once tests were available, they decided then afterwards, as soon as we reopened, to go and get tested. So this delay strongly improved over time, but still were very long if we want to use testing and isolation as a pandemic fighting tool. In terms of what happened, in terms of, let's say, going back to normalcy for people, you see in the center, that is the percentage of people who are going back to workplace. 0 would be the expected level. Exiting from lockdown, there was still somehow a tail of the effect during the first couple of weeks. And then you see that people were sort of abandoning telework progressively to go back to work. Paris region is the one that really stands out. It was the most affected region. It is highly dense, and also saw sort of an escape, a true escape at the beginning of lockdown, with 25% of its population leaving the area to go to second houses where to spend lockdown in order not to be trapped in small apartments in Paris. And given that schools reopened after lockdown, but on a voluntary basis, we expect that many families didn't come back also for that reason, because there was those who could continue teleworking and didn't want to send kids at school, remained in the other places. And then on the right, those are other data which are collected from large-scale surveys and on the use of the systematic adoption of preventive measures. And here I'm showing just one indicator, that is the avoidance of physical contacts. And you see that it was very high just during lockdown. I'm not even showing the data, but it was like 98%. And there is a continuous drop over time. And after 4 weeks, you have about 30% decay of adoption. And this was similar across age. The decrease was similar across age classes, which we wouldn't expect a priori. We thought that.
How was that measured? Was that from a survey?
Yeah, from a survey. And so in principle, we thought that older age classes would continue to protect themselves more with respect to the others. And instead we saw the same type of decrease. And so, of course, what we did was to go back to our models and then analyze region by region, once again, calibrating the models after the first wave on the post-lockdown phase, always on hospital admission data, and then trying to reconstruct and estimate the true number of cases that were seen in that moment, and then compare to the data. So in that sense, nothing new compared to a lot of other studies. We used the data that you saw before on workplace attendance and also adoption, as they were changing over time and changing over region, to inform the model. And what you can see, I'm showing here only, again, Ile-de-France, but the entire nation is quite similar. In the total period from May to end of June, which is the one displayed on the x-axis, we were able to detect only 1 case out of 10, which is extremely poor. This is something that was, for example, estimated in other countries while they were handling a big wave. And especially, of course, is extremely poor compared, if we think that this system was implemented with the unique objective of detect as much as possible to slow down the epidemic. The detection rate increased over time all over the regions, thanks to 2 aspects. On one side, the favorable epidemic conditions, so the fact that people still were afraid, not going, you wouldn't see a lot of people going to commerce, restaurants and bars yet, and they were all were very careful with prevention measures. So we saw a continuing decrease of the epidemic wave, and at the same time an increased capacity of the system. So more people tracing, more laboratory testing, and so of course this led to increase. A lot of geographical disparity, however. So there were regions who still at the end of June were able to detect only 10%. And then we used the participatory cohort that we have in place since a decade now for surveillance of ILI in the population, to somehow try to validate these projections of the model, and also to identify what was the problem. At that time, mainly the problem was that symptomatic individuals were not consulting, and GP consultation was necessary in order to have a prescription to get tested. And so if you were skipping that step, you would not get tested. And so we suggested authorities to make it more accessible and easily and more rapidly accessible also, because the full timeline would be taking an appointment with your GP, getting there, getting prescription, taking another appointment to the lab, and then going to the lab to get tested. And of course, you spend your full infectious period while going around in the community. And then summer hit. So our study was up to the end of June. That is the closure also of the school calendar, and then French generally go on vacation, spread out throughout July and August. All the activities restart in this week at the beginning of September. And we also stopped our analysis at that point because let's say, some of the parameterization of the model were not so easy to do during summer because a lot of people go on vacation. We didn't know how COVID-19 would impact the way people were going on vacation, whether they would stay more in their region, whether they would travel but within France. And also we didn't know we didn't have good data, of course, to, let's say, parameterize these contacts. Once you have schools and workplaces, it's easier, and you have data on attendance, it's easier to do with respect to all the leisure activities, of course, during summer and the mobility. So just to give you an idea, what happened is that all the regions basically increased their mobility substantially, even 50% more compared to the mobility that we registered before the first wave. We're still waiting for data to make them comparable to last summer. This is something that we still don't have access to. In terms of people going to work, of course, after the end of June, that would be, let's say, the highest dots in those plots. There was a decrease because people started to go on holiday. And this was consistent, very similar behaviors across all regions, same type of behavior also in the Paris region, but also this difference, this discrepancy between the region of Paris and all the others that was kept along. And then we had access to additional data on preventive measures, so additional couple of points. And there you see that there is somehow more perception during July of the importance of preventive measures. So the decrease is not as fast as it was during May, June. And this is also due to the fact that even in absence of increased viral circulation during the month of July, there was a lot of talk in the news and by authorities about COVID and the pandemic, without so much effect or changes, except let's say that probably this had an effect in creating some concern, and so people were more careless, let's say, had a different relaxation, was not as fast as the beginning. And if we look at what happened now up to the data here, I'm showing data for hospitalization up to mid-August. The usual situation is that we monitor the situation across time, and by the end, second half of July, given also the analysis of under detection that we had, we started to let's say, express concerns in the fact that a second increase of cases was likely to happen. And up to mid-August, this was still, and the narrative was still that everything was okay, in the sense that the majority of cases that were seen were exclusively asymptomatic cases in the younger age group. And this was not a problem for the rest of the population. This was not a problem for the healthcare system. Of course, I imagine, I'm sure that you share the same difficulties into trying to communicate instead, let's say, otherwise, and trying to really interpret this data. And already at this point, it was just a simple change of scale was enough to show that there was a consistent increase of hospital admissions in the region of Paris. And then especially, if you look at the level that was reached, let's say, by mid-August, which is the end of this time frame, and you trace it back to the beginning of the first wave, you would see that we are 1 to 2 weeks at most before the beginning of lockdown. Now, clearly, these situations are totally different. Doubling time is about 9 times longer. And of course, this is reassuring, but at the same time, the problem for us was that nobody had even looked at the data in the right way. And so we had somehow to alert the authorities of what was the situation. And indeed, in the second half of the month of August, that was when there was an awareness also in the communication by authorities. There was last week there was a first press conference by the Minister of Health and by the Prime Minister, once again after a long pause during the summer, let's say, to say yes, they are increasing, we shouldn't worry too much, but we should worry nonetheless, which is also somehow a very conflicting message, unless you are able to quantify that so that people are able to understand it. As usual, risk is always to my understanding, risk is always well perceived if it is at the two extremes. So very low risk, very high risk, and every situation that is in the middle is very hard to communicate. And just to give you an idea of what's happening right now in the country, you have clearly, let's say, three different groups of regions. Some of the regions who show an increase like Ile-de-France, some of them a much faster increase, about every 2 weeks, doubling the number of hospitalization, which is quite concerning at the moment. The city of Marseille and the city of Paris have been undergoing some specific measures like universal masking and also closure of bars and restaurants in Marseille after 11 p.m. to somehow cut down on the festive agglomerations of people. Some other regions do not have a clear tendency yet. They're very noisy, and some instead still have a very flat behavior. And going back to that exit 3 is of course, this is not a message for this community, but is more a message on the communication aspect, in the sense that we plotted just a few days ago, and we went back to the exit strategy, the number 3 that we proposed in the middle of April. And it was one that showed that it was possible, of course, clearly possible to have an increase of cases. And it's not exclusively, of course, we're not going back to normal conditions. No country is going to do that. But there is a non-trivial and also hard to predict interplay between the force of your tracing system and then also the type of either relaxation of adoption or also the reopening that you do in terms of commerces that are open, theaters, cinemas, and all that type of activities. And that is the situation. So that is the same scenario with the data that we collected so far up to the end of August. If we have to refit now, so these are the results that we provided by mid-August, we saw that differently from the hypothesis that we made in April, the actual scenario was characterized by a lower capacity of testing. We were more optimistic at that time in the capacity of testing. And on the other hand, we were, well, let's say, thanks to a more efficient testing, we were proposing to relax more. So we were showing if you're able to do this much testing, more than 50% of, for example, of infections, tracing more than 50% of infections, then you would be able to relax a lot of different activities and then reopen your economies more. And what actually happened is that the capacity was much lower, but the concern and perception of people that led them to keep for some time preventive measure was stronger. And also in some regions like Ile-de-France, the reopening was occurred in a slower way in 3 different phases. For example, with restaurants opening much later, and cinemas like in July. So there was a real progression on a longer time frame that we envisioned at the beginning. And so, and this is it. So there is, in terms, let's say, of there's not so much new results into that, but I thought that it was, or at least I was hoping that we could, you know, compare, especially with respect to the situation that you're living now in the US, and so showing you a little bit what we did in this respect, and what probably is facing us ahead in the next weeks. Thank you.